Good evening, everybody.
I'm really honored to be here and to talk about our extremely delayed state budget. My name is Michael Kinnucan. I'm the Health Policy Director at the Fiscal Policy Institute, which means I know about Medicaid, I know about employer-sponsored insurance. I do not know much about taxes or SNAP or the CLCPA. But I'm going to try to crib from my colleagues, give a sort of brief overview of where we are in the state budget, and then talk about healthcare. And I'm going to try to be really, really quick, so like 15, 20 minutes max, and then I think we'll have some time for questions. So, going into the state budget season at the beginning of the year, right, there were a few really important pieces of political context. The state was experiencing, as it has for the past several years, really strong revenue. That's mostly a reflection of, we live in a very unequal state, but Wall Street is continuing to do really well, and so there's sort of more and more revenue. There's also flat Medicaid growth, which is a new thing, new context for the state. In the past several years, we've seen really sharp increases in Medicaid. That's flattened out. So the state had a bunch of money, and then the state was facing a challenge of sort of, first of all, looming really, really big and significant federal cuts, especially to the state's Medicaid program. Those cuts we calculated to be about $10 billion in cuts phased in over time to the state's economy, but beginning this year. And then we had a mayoral election here in New York City that some of you may have followed, that sort of set, I think, a different tone and put certain issues on the agenda.
You were going to be Where's Jeremy? There's Jeremy. There's Jeremy, who works with Micah, who brings us lots of literature because we give it away so fast. But Jeremy is going to be giving us information about some street fairs on the east side. So again, grab your passports and let's join Micah over there. We really need to work very hard on his behalf because as you read in the paper, Schlossberg, who really hasn't ever done much in his life, is doing very well because of his name. And so it would be really great to have the support of everybody who can make it, whether you're on the east side or the west side. We're going to have a subway with Micah coming up. I think it's June 5th, but Chuck will be sending out the blast about that. And in the meantime, we also have Eli, with whom we're working very hard out of his storefront at the old Silver Moon at 105th and Broadway. Lorraine, raise your hand. Turn around. You can all see Lorraine raising her hand. Lorraine, raise your hand. There's Lorraine. Lorraine is running tables every afternoon out of Eli's storefront, along with Billy and Marianne, who's hidden back there. Marianne and Billy, raise your hands. They're working with Lorraine, and Corinne is working with Chuck and me on Friday mornings from 8 to 9 at the subway at 96th Street and Broadway. Wendy has something urgent again? Okay. So it would be really great because Eli has some strong competition. I don't know how many of you are on Twitter, but there's a nightmare going on now with all the PACs and who's supporting whom and who's trashing whom, and it's really not the way we like to behave on the Upper West Side, and Eli is not taking any PAC money. And so we really could use your support for Eli also at the subway Friday morning at 96th Street and at the 123 from 8 to 9. Chuck and Corinne and I will be there. And then Eli will be going over to the farmer's market because it's a very handy thing to do. In addition, we will also have our meeting on June 10th, which will be our meeting, the Three Parks' last meeting of the year, so to speak. And so we hope you'll all join us for that. We're working on getting a speaker. We may already have speakers lined up for our meeting in September, so that would be great too. And in the meantime, although we do not meet over the summer formally at the youth hostel, we do have our picnic. How great is our picnic? How great is our picnic, right? Our picnic is great. Everybody, the who's who of New York comes to our picnic. We don't have a date yet because we don't have a parks permit yet, but usually it's in mid-July, and we will keep you posted about that as well. I am going to take, yes, Wendy. Wait, you have to wait for a mic. Does someone have a mic for Wendy, even though she's not speaking at mic time? You have to, yeah, there you go.
Hi, I'm Wendy Diller. So I just also, in terms of supporting Micah, we have there is a meet and greet for your friends. If you have friends on the east side, we have a meet and greet for him on May 30th. So just see me or see Jeremy about it. If you have friends on the east side, just let us know and we can invite them to it.
I just want to clarify, this is a meet and greet. It is for people who don't really know Micah so that they can get to know him. Because once you know Micah, you love Micah, and you can see how talented he is and how much skill he has. I just want to recognize a couple of other people who are with us besides Oscar tonight. We have our candidate for state committee, Jacob Kimbaro. Stand up, bow, wave. Yay, Jacob. He's the one person we're supporting who doesn't have heavy competition, so. I think we can do better than that. Tonight, we are very lucky. Don't worry, you can sit for another minute. Tonight, we are very lucky to have Michael Kinnucan of the Fiscal Policy Institute. He is the senior health advisor there, but he's also a member of the Mamdani transition team on health. And I just want to say, having followed the Fiscal Policy Institute for years, they do tremendous work. They make all of the number crunching they do extremely accessible, and they are just on top of everything that's wrong, everything that could be right, and how to get there. I saw a wonderful presentation that I'm going to take the liberty of asking the first question about, which is the $10 billion cut in Medicaid that the state is facing, and how maybe the governor and our elected officials are not doing what they should be doing to close that gap. So I just want to say that we are extremely lucky to have him here today. He did say he wanted to sit for a few minutes. Now it's been 6. Is that enough? Are you ready to go? All right, so please give a warm, warm welcome for Michael Kinnucan.
Thank you all so much. I'm really honored to be here and to talk about our extremely delayed state budget. My name is Michael Kinnucan. I'm the Health Policy Director at the Fiscal Policy Institute, which means I know about Medicaid, I know about employer-sponsored insurance. I do not know much about taxes or SNAP or the CLCPA, but I'm going to try to crib from my colleagues, give a sort of brief overview of where we are in the state budget, and then talk about healthcare. And I'm going to try to be really, really quick, so like 15, 20 minutes max, and then I think we'll have some time for questions. So, going into the state budget season at the beginning of the year, right, there were a few really important pieces of political context. The state was experiencing, as it has for the past several years, really strong revenue. That's mostly a reflection of, we live in a very unequal state, but Wall Street is continuing to do really well, and so there's sort of more and more revenue. There's also flat Medicaid growth, which is a new thing, new context for the state. In the past several years, we've seen really sharp increases in Medicaid. That's flattened out. So the state had a bunch of money, and then the state was facing a challenge of sort of, first of all, looming really, really big and significant federal cuts, especially to the state's Medicaid program. Those cuts we calculated to be about $10 billion in cuts phased in over time to the state's economy, but beginning this year. And then we had a mayoral election here in New York City that some of you may have followed, that sort of set, I think, a different tone and put certain issues on the agenda. And so where we're at right now in the state budget process, the executive and the legislature sort of came out with their competing proposals. They reflected actually a lot of consensus, but not consensus on everything. And so the executive and the legislature are fighting it out. And the budget is, at this point, a couple of weeks late. People complain about that. Reporters like to say, like they're late with their homework. This is kind of the only thing they do all year, so I'm glad that they're working hard on it and fighting over it because it's really important. So the executive and the legislature had consensus on a couple of things, one of which was childcare. We saw a significant investment in childcare. We are not at universal childcare, right? Like in the first year, we're only getting about 20,000 seats for 2-year-olds in childcare, but we are on a path to universal childcare, and so that's really exciting. We also saw a lot of money for hospitals, nursing homes, doctors in the state budget, like a reflection of sort of these Medicaid cuts are coming and we're going to fund healthcare providers. What we also saw in both the executive and the One House budgets was a real lack of willingness to sort of put the state behind protecting some of those benefits that the Trump administration has chosen to cut. So we're on the cusp of hundreds of thousands of people losing access to SNAP, losing access to Medicaid and the Essential Plan. The executive budget essentially shrugged its shoulders at that, right? And said, well, it's federal money, there's nothing we can do. We at the Fiscal Policy Institute really strongly disputed that. Our view is Trump cut taxes for the rich and cut Medicaid. We in New York can respond by raising taxes on the rich and refunding Medicaid, refunding SNAP. But unfortunately, that view wasn't reflected in the One Houses. And so the key sort of points of disagreement were things like CLCPA, which is still being fought out, issues around auto insurance, and importantly, the fiscal health of New York City. Yeah. The Community Something Climate Protection Act. Yes, the climate rollbacks, right. So the governor is pushing to weaken New York State's climate commitments that we passed in 2019. The legislature has been pushing back on that. It appears that the governor will be successful in weakening some of those commitments and targets. So that's a major disappointment for us. And thank you for, please, if I tend to be acronym heavy, so please intervene if I do it again. The two big, and so that was sort of the big picture political context. The governor announced a deal last week and said, we've landed on a budget. Then the Speaker of the Assembly came out and said, we do not have a deal. We could negotiate for 6 more months. I told her not to say we have a deal, we don't have a deal. So the question is sort of what is outstanding in the budget now that they're still negotiating, having announced a deal. One thing that appeared to be outstanding was funding for New York City. New York City is facing a huge budget gap, and it's a big problem for this between the city council and the incoming administration. There was, the mayor and the speaker came together to sort of say, the state should fix this. The mayor wanted to see an expanded ability for New York City to tax its wealthy in order to fund the budget. Just yesterday, the state announced some more money for the city that will help it settle its budget. It's not really new revenue. It's actually the state sort of weakening some spending mandates. So one of those, disappointingly, is the state delayed the city's obligation to comply with class size laws. That freed up some money, and also allowed the city to stretch out its pension payments a little bit, which freed up by itself like $2.5 billion. And so these are one-time sort of investments and ways of getting money, and they're not gonna in the long term sort of solve the city's fiscal problems. And now, with all that context, I'm going to talk a little bit about the healthcare situation. So in New York State, because of the Trump cuts, because of the reconciliation bill that passed last summer, we're seeing an enormous risk that really hundreds of thousands of people are set to lose healthcare this year. And really, they sort of fall into two groups. First, there were big Medicaid cuts, and the Medicaid cuts take the form of making it a lot harder for low-income people to get enrolled and stay enrolled in Medicaid. There's a work reporting requirement, and then there's a requirement that you have to reprove that you're eligible for Medicaid every 6 months. Both of those are burdensome, not because there are a lot of adults on Medicaid who don't have children, aren't in school, don't work. Our sense is that the vast majority of people on Medicaid who are adults either already meet the work requirements or qualify for one of the exemptions, whether they have young kids, they're disabled, they're in school, stuff like that. But proving to the federal government every 6 months that you work, particularly if you are or to the state government, but with federal oversight, that you work, particularly if you are a gig worker, you're a seasonal worker, you work on a farm, you're a freelancer, that kind of situation, it makes it really, really easy to fall between the cracks. And our expectation, based on the experience of other states, is that hundreds of thousands of people, I estimate 800,000 people are likely to fall through the cracks. So right now there are about 5.4 million people in New York State on Medicaid. Our expectation is that 800,000 fewer could be on Medicaid in a couple of years. So that's really, really damaging to those people's health and to the healthcare system we all rely on. The other cut, and so those changes to eligibility go into effect this coming January. But there's actually an even more urgent threat involving a New York State program, a really fantastic New York State program called the Essential Plan. The Essential Plan, it's kind of this wonky thing that a lot of people, probably you all are an especially well-informed audience, but many people haven't heard of it. But it's a big New York State program that's unique, that provides health insurance to 1.7 million people who are below 250% of the federal poverty line. So that means for an individual, that's about below $40,000 a year in income. For a family, it's higher, right? But who don't qualify for Medicaid either because they make too much or because their immigration status doesn't allow them to enroll in Medicaid. So the Essential Plan was really dramatically cut by H.R. 1, and there was a question of how the state was going to address those cuts. And the direction the governor went was to sort of lower the income limit where you can be on the Essential Plan. So right now it's 250% of poverty. It's going down to 200%. And that means that all those people in that window of 200 to 250 are out of luck. They're going to lose the Essential Plan. They're going to have very limited options to remain insured. And that's happening really soon. It's happening July 1st. So those folks have already gotten letters saying, you're going to lose your insurance pretty soon. And so we're really, really concerned about both of these issues. The Medicaid one is a lot harder to fix, unfortunately. But the Essential Plan one, there is a really clear path, and the Community Service Society and Make the Road have laid out a path where we can actually keep the vast majority of those folks insured on the Essential Plan by investing some state money in it. And that's one of the big outstanding issues in the budget that's still being negotiated. I've been hearing rumors about it as recently as this afternoon about where it's at. Is the state going to sort of step in and prevent these cuts or not? It's very uncertain. So please call your assembly member and senator and urge them. So that's unclear. What is clear is that we're facing a really, really challenging moment for the New York State and city healthcare systems. We're a state where between Medicaid and the Essential Plan, about 7 million New Yorkers, so that's about 35% of the state, rely on Medicaid or the Essential Plan as their main source of health insurance. And then Medicaid also provides long-term care to another 450,000 or so older and disabled New Yorkers. So it's a really key part of our healthcare system. When people lose that coverage and it faces this kind of squeeze that affects those people, but it also affects the hospitals that serve them, the doctors that serve them, the neighborhoods they're in, their families, et cetera. And so I think it's really concerning that we're there, and I think it's been sort of surprising to the degree to which this hasn't been really front and center in the state budget, and disappointing. And so I think that's where we're at, and I could go on and on, but we prefer using the rainy day fund to cutting services that we can't replace. But again, it's a little outside my wheelhouse.
Thank you. Thank you. To follow up on Bruce's question about the New York health plan, I'm also a city retiree. Right now, we have we have our regular Medicare, and then any doctor who takes Medicare and Medicare doesn't pay for the whole bill, then our version of Emblem Health will pay for the rest of it. How would that work with the New York? Would we still have Medicare or what? How would that work?
It's a great question, and I was talking this weekend to an aunt of mine who's just now enrolling in Medicare and is like, I had no idea Medicare was so expensive. Oh my God, like you have to buy a supplemental plan, and then, there could still be copays and so forth, right? So there's this sort of, to be honest, New York Health Act leaves open how we would implement that, basically depending on what the federal government wants to do. To my mind, the easiest way to do it would be people would stay on Medicare, and then instead of having Emblem as the supplemental plan that wraps around Medicare, you would just have the New York Health Act public plan as the plan that wraps around Medicare. And I think we could fill in a lot of gaps in terms of like coverage for Medicare, especially for folks who aren't in a union or in a strong union, don't have that coverage, right? Like we could sort of provide that supplemental Medicare for everyone, which would be good. So that's my view on sort of how we would want to approach it. Yeah.
I think you had a question, sir. Shove this man here with the green vest.
Is the state Medicaid agency doing anything to address sort of the paperwork hurdles that the new Medicaid law is presenting to recipients to assist them in overcoming it? And is there a role or a need for other groups like, nonprofits, community agencies to help?
Yeah, really good question. So the state Department of Health is, from my perspective, they're doing the best job they can of sort of helping people stay enrolled in Medicaid. And we're lucky, like a lot of states that have tried to implement Medicaid work requirements in the past, they hate Medicaid. So they're just trying to make it as hard as possible. New York's going to take the opposite approach, and there's a lot of stuff you can do. So like, the state collects unemployment insurance, so it knows if you get paid a wage and UI gets taken out, it knows that you got paid that wage, and it can actually automatically say, oh yeah, we see this person is getting paid a wage, they meet the work requirements. Or they can say, oh yeah, this person is, has a registered disability, and so they're exempt, right? I think the state is going to do as much of that as it possibly can, and there are limits, right? There are people who are getting paid on a freelance basis, or, the data doesn't match, right? Like, I think we're all about to see in January how well that all works out. But in the meantime, I think there's an enormous need, or sorry, not in the meantime. Either way, once January comes around, I think there's an enormous need. There's going to be an enormous need for people to have like that personal contact that can help them navigate it. The state runs a navigator program with a bunch of local community group affiliates. The new city health commissioner is talking about how the city health department is gonna work on that as well. But I think paying attention to that navigator network and what they say about how people can plug in as volunteers or as organizations is going to be really important.
Hi, thank you very much for coming and speaking. I was wondering if you had any idea about how artificial intelligence might play into what you've been speaking about and about the med system, in the sense that I know, for example, the New York City school system, has come out with a policy statement saying, how they're going to use it, where it stands, et cetera. So I was wondering if there's something similar in the medical establishment.
Yeah, it's a great question. I feel like it's this new tool that is going to probably be used for good and for evil at the same time, and probably in our healthcare system, the evil will outpace the good. But I think there's already folks saying, oh, AI can help doctors diagnose rare diseases. That's a good thing. And then there's also people saying, oh, AI can help, private equity-owned radiology practices bill even more for each service by sort of using big data to identify the things they're not already billing, right? That's on the other side. I think it's a question I'm definitely tracking, but I don't have anything coherent to say about it yet.
Yeah, just a quick point to clarify the Essential New York program. You said that's unique to you, New York, is that correct?
Yeah, that's right.
So the changes there, have they been caused by withdrawal of federal funds?
It's a great question. So the situation is like in the rest of the country, people who earn too much for Medicaid but are pretty low income are mostly on the individual market. So they're on the ACA exchanges. And they get premium tax credits, but the premium tax credits, even with the premium tax credits, the insurance is expensive, the deductibles are high, and so forth. And so in New York, we said, okay, instead of doling out these premium tax credits and letting people sort of wind their way through the marketplace, we can do better than that. The federal government can just give us all of the premium tax credits people would be getting, and we'll run our own insurance plan called the Essential Plan, right? And we'll sort of use that federal revenue to run a public program. And it turned out that the public program was like way better and way cheaper than the private market. So we wound up actually running a program that offered 0 deductibles. It was free for enrollees. And it serves a huge number of people, again, 1.7 million people. So it's a real policy win in New York. And it's not, to be clear, it's not going away, it's just being shrunk. So people under 200% of the poverty line will stay on the program. It's people between 200 and 250 will be kicked off. And so the question is how are federal cuts sort of interacting with this unique New York program? The answer is basically the H.R. 1, the One Big Beautiful Bill Act, cut premium tax credits for lawfully present immigrants who are on the exchanges. And so, if you're a green card holder who's been here for 3 years and you're on the path to citizenship, last year you could get premium tax credits, now you can't, right? To be clear, undocumented immigrants were already not eligible for premium tax credits. So we're talking about people who are, doing, playing by the rules or whatever, but the One Big Beautiful Bill Act said, you don't get health care, screw you. And so in the rest of the country, that means that those individual people lose tax credits and lose access to insurance, and that's a catastrophe for them. In New York, because we use the premium tax credit sort of funding flow to do the Essential Plan, what it looked like was the equivalent cut was a big cut to federal funding for the Essential Plan. And so, that's how all that works, yeah.
Do we have any other? Oh, Debbie has a question. I'm sorry.
Can you address status for home health aides, both from the terms of the aides and remuneration, as well as the issues regarding their time and all that, as well as recipients, and how the changes in the budget and the laws may affect recipients for home health aides?
Yeah, that's a great question. A huge part of the state Medicaid program is to provide home care. And so what that is if you're elderly or disabled and you need help with activities of daily living, like bathing or eating or dressing, that kind of thing, then Medicaid is the program that will pay someone to go to your house and help you out so that you can live independently. You don't have to move to a nursing home. And New York has been a national leader in providing that kind of care, and it's a big part of the state Medicaid budget. So the One Big Beautiful Bill Act did not directly cut that program, but first of all, it put a big squeeze on the Medicaid budget overall, which is going to squeeze the already, too low wages of home care workers. That's a huge concern. And now the federal government has been going around accusing blue states of fraud, saying, oh, your Medicaid program is full of fraud, and especially your home care program is full of fraud. RFK Jr. has said that this whole home care thing is nonsense because your relatives should take care of you for free, and so that's his solution to it. And so there's a lot of threat, actually, of executive action to cut that program off. And so that's really frightening. There is definitely a real threat there. I'm not in a rush, but I don't want to take over your whole night.
Hi, you had mentioned the union opposition as one of the main obstacles to the New York Health Act. I was wondering if you could, in your opinion, list some of the other ones.
The other obstacles?
Yeah, just detail what's holding leadership from bringing it to a vote on the floor, that kind of thing.
Yeah, I mean, the way I think about the political situation is that I think unions ought to be natural allies to this, but there is a lack of trust and confidence, a real investment in the health benefits that have been won by union workers that's sort of preventing that coalition from really coming together. I do think that the health insurance is getting so expensive that, for instance, New York City employees, it looks like, are going to lose access to New York Presbyterian and its network of doctors because there's a dispute between Emblem and New York Presbyterian. So, there is this sort of escalating cost that is, I think, causing some people in the labor movement to rethink that commitment. And so I think there is a possibility of us sort of having more discussions like these and sort of coming together. But once you build that natural coalition, then you got to take on the actual opponents of healthcare reform, right? Which is, the insurance industry is very powerful and wealthy and spends a lot on politics and would be eliminated by the New York Health Act. So that's challenging. I think also, any single payer system has to decide what to pay, right? What to pay providers, what to pay doctors, hospitals, drug manufacturers. I think it's plausible that, for instance, if we did the New York Health Act, we would probably not adopt the current US system of paying drug manufacturers whatever number they write down, but would probably pay them somewhat less. And so that means they'll be opposed. I think doctors and hospitals could really stand to benefit from the New York Health Act because they wouldn't have to chase around for billing, they wouldn't have to buy expensive billing software. But there's a lot of inequity in how we fund, medical care in hospitals, right? So private prestigious hospitals get paid a lot more and safety net hospitals get paid a lot less. We would have to work through how we wanted to make that funding more equitable. That's the kind of thing that could be controversial. And then, we also have to figure out how to fund it. It's one of these things where we know we could save money overall, and we know that we all pay too much for healthcare, both in terms of directly, but also in terms of all of our wages are lower because our employers are spending $10,000 or $12,000 or $15,000 a year buying healthcare for us. And so there is a positive sum way to finance it, but it's challenging to figure that kind of thing out for a very large sum of money. And so I think there are challenges to doing it. I do think that, number one, there are these problems that are emerging that I talked about that are going to make more and more people inclined to support it. I also think that when we cover 7 million people on Medicaid and the Essential Plan, and if we, as a state, for instance, started to regulate drug prices, started to regulate hospital prices, started to remedy some of those existing inequities, then we are taking steps toward a better healthcare system that would also make it easier to move to a single payer system, right? So I don't think that it's just like we're in our current horrible system and then suddenly we jump up. I think there are ways to make progress.
I just had a quick question. How much would it cost to bring the Essential Plan back to the 250, bring it back, and where would that money come from, in your opinion? Given that we are at an impasse about raising taxes.
Yeah, it's a great question. I mean, this state budget is really, we're really in the black. We're doing great as a state financially, and so there's a lot of money and enough money that the executive budget puts a lot of money into rainy day funds. Enough money, I might add, that the state is giving us all a one-time utility rebate, which is just $1 billion spent of, tax monies mailed out to every household to on a one-time basis to apologize to us that our utility rates are too high, which is a crazy way for the state to spend money. You should address the underlying problem of utility rates and actually bring down costs, but you shouldn't just sort of throw money around. And this is the second year in a row. Last year we had a $1.5 billion affordability rebate. I forget what Governor Hochul even called it, but it's a one-time check. And I think it speaks to the fact that the state actually does have the money to do stuff like this. In terms of the cost, my estimate is that it would cost about a little more than $2 billion a year to completely replace the Essential Plan for all 450,000 people who are about to lose it. I would emphasize that's not money that sort of flies away, right? That goes back into the healthcare system. But because that's proving really, really challenging to achieve, advocates have also noted that right now the Essential Plan is free, which is great, encourages healthy people to get on insurance and so forth. If you charged a $50 a month premium, then the cost would fall quite a bit because people who are like I was when I was a 27-year-old man, think they're immortal, will not enroll anymore, right? So that brings down the cost anymore. A little bit. And so if you went that model, it would only be about $400 million in this fiscal year and then $700 million on an ongoing basis a year. Yeah.
So I think, so I just want to say thank you very much. And before I sign off, first of all, I'd like to welcome Eli Northrup, who just walked in, our candidate for assembly. Before we close, I'm going to take the privilege of asking the last question and making a pitch. Everyone should log into the Fiscal Policy Institute website. They don't send that many emails, and every email is full of essential information and really makes it accessible, as you can tell from tonight. I saw a presentation that you did with some of your colleagues about how to make up the $10 billion shortfall, and one of the things that you all suggested, which would get us somewhere between $6 and $7 billion, would be raising taxes on people who make $250,000 and up 1 to 2%, and that would get us $6 billion, and I was hoping you could share a little bit of that knowledge, and then we will let you go home.
What else is there to say? I mean, we think it would be a great idea. I mean, there's this funny dynamic where there's a lot of political resistance to doing even that kind of fairly modest tax change, even when it could, I mean, we're looking at a state budget where 450,000 people are going to lose their health insurance, not like someday on some vague date, but on July 1st, right? And so, I really, that tax change that you described on a small but not tiny group of people who earn over $250,000 a year, to my mind, that just seems like a natural place to look to fully address that problem. I think, I don't like to talk about taxes as like, we gotta soak the rich, it's a punishment or whatever. I just think we all wanna live in a state where people can have access to health care, and the people who can afford it should give a little tiny bit of their income so that that can happen. Unfortunately, that doesn't seem to be the majority view among our policymakers, so it's disappointing.
All right, let's give it up for Michael, please.
Thank you all so much.
Such a pleasure to meet you in person. Anytime you want to come back, you let us know. All right, so we're all much smarter now than we were when we walked in. So we are going to hear from Oscar Romero, who is going to tell us a little bit about what's going on with his campaign for Congress. And after that, we're not going to hear from our state committee members. We're not going to hear from our district leaders because they're all homesick. So Oscar, come on up. Let's give a warm welcome to Oscar, please.
Hello, everybody. Well, it sounds almost like we need universal health care, doesn't it? Right? It doesn't help when half of the people in Congress and the Senate are millionaires and billionaires themselves, and then they govern to not ever get taxed, right? Well, so I'm here to talk to you about a couple of updates that I wanted to share, not only about the campaign, but also about the work that we have been doing in the community. But I figured it would be a good idea also to answer some of the questions that were asked about AI, since, I'm, I believe, the only chief information officer running for Congress in New York State right now. So I'll tell you a couple of things. So when it comes to AI, I think it helps to ask two questions. At what cost and for what? So the first one, at what cost? Many of the different technologies that we're deploying are being inflated for the purposes of some individuals to just be able to fundraise more money and get more money from the federal government. You get that from Elon Musk. You get that from OpenAI. You get that even from the folks in Anthropic. So there's this whole bubble of creating the perception that AI is there to help us and solve a lot of problems, to fundraise money, enrich themselves, and continue to manage to continue to create this expectation. Now, that being said, there's also places where AI can be helpful. Those places are certainly not us sending each other texts where we can change the emojis that we send. So there's a desire to use AI in absolutely everything for consumption purposes, which then again is designed to make us use it more, and that creates environmental costs that are unsustainable. The data centers that we have today, for example, across the nation, they're using coal plants and high-polluting energy sources that were actually already scheduled to be deprecated, but continue to be used today in a lot of communities of color to power these centers. To give you another more dramatic example, there's external companies, for example, international companies like Turkcell, that provide energy services. Should I bring it up? That provide energy services in the countries that are in the context of war. So say you are in war, you can actually get basically a high-polluting boat that plugs and play into the grid and provide energy resources. So many of our AI centers, for the first time in US history, are getting actually powered through these kind of high-polluting emergency war energy supplies. because it doesn't matter how expensive it is, they have the money to pay for it. And the consequences of AI, as in it being actually helpful, is not true to everything. We have been talking to a lot of DOE teachers that tell us that young people in 9th grade cannot write a paragraph. And they actually tell you, really? Does it have to be 3 sentences? Right? And there's a lot of challenges when you use these systems to actually provide education, because they take away a lot of critical thinking and nuance. There's this concept called the universal voice, where AI is designed to actually give you a finite answer to a lot of your questions. So if you ask the software, what is the best song of the 90s? It is going to say something, right? And so that takes away the opportunity for people to actually inquire, learn, understand different perspectives. And the questions that you ask come with also the bias of the sources of information that it is getting its data from. Most of the information that we have in English, that is what is ingested to provide us with whatever responses we get, is actually representative of the US and Western cultures, and not really the richness of the world. So I'll leave it at that. Just in terms of the medical role and use of AI, there's a lot of places where it could actually be impactful when it comes, for example, to image checking for X-rays or assessments of different illnesses. But again, the places where you are seeing it being deployed is actually in insurance companies to deny the claims that people are making, or to even tell these systems to say to the doctors that what they are determining is actually not true, right? And then the doctors actually have to know and do the work of pushing back to be able to get their actual prescriptions approved, right? So I would say, all in all, very damaging. That's really where it is. And so a couple of updates on the campaign. So one of the things is just in terms, I wanted to talk to you about ballot access. So thanks to the help of some of you that were actually canvassing and getting petitions out there, we are on the ballot. So unfortunately, there have been people that have been running campaigns of misinformation saying that we will not qualify to the ballot. As you know, sometimes with the Board of Elections, people challenge petitions. So there's a time when it is unclear whether or not you're on the ballot. All this to say, it's official, we are on the ballot, so you will see our name come the day to vote. Now, the next thing, as you have heard, there was a terrible fire that happened in Dyckman, right? And so there's unfortunately three members that have died as a consequence of the fire, and 7 people that are in critical condition in the hospital, and about more than 100 people that have been displaced. So one of the things that everybody's trying to do right now to support the families is to go to the Holy Trinity Church. You can go to their website. There's an area for donate. I will share the information with the folks from Tree Park so they can share the links with you. So please, if you can, go donate. The fund is a general fund to support the families. Everybody's just trying to fundraise to address the challenges that those families will have ahead. Now, another issue that we have to talk about, and this is important, as much as it is critical that we render honor to the people that we have lost, it is important that we don't wait a second to demand that the politicians that are supposed to create the policies and enforce the policies to prevent these kinds of things from happening do that. You know, it has been just reported last day that the fire was caused by somebody inadvertently just throwing a cigarette in a pile of cardboard. But nonetheless, the building where that happened had more than 100 violations. And some of the violations were for doors that do not automatically close. I work on housing across the district, and particularly in Inglewood and Washington Heights for 7 years. And there's a lot of other fires that happen because actually the landlords don't provide heating, people buy the little heating devices, those are prone to catch on fire, and the same story repeats itself. Even though there's technologies already out there for us to deploy sensors and actually be able to simply send to the landlords the moment that the temperature is below the heat low, hey, you have to provide the heating, first warning, second warning, here is your bill. So it is important that we don't let the fact that this fire was not caused by that kind of landlord negligence, that we don't let that make us forget about the 100 violations that the building had, and that in fact many of those were the reason for the fire to expand the way that it did. Lastly, the other thing I wanted to talk to you about is the FIFA. The events from the World Cup are starting to happen everywhere, right? And you're going to see a lot of soccer. And with that, as you know, a lot of the immigrant community across the city loves soccer. Many of them who are in different statuses, some of them undocumented. And so ICE raids, now that they have left the airports, are going around the city. So it's important that you know your rights and that you know what to tell to folks when they encounter ICE. We are actually providing trainings and that our campaign is facilitating, so we'll make sure to share that information and perhaps even do a training here. There's basically 3 things that you need to know. Families that may have somebody with a regular status, there's things they can do ahead of time so they're ready should they ever be kidnapped by ICE. Then there's things that families can do once ICE has kidnapped them. For example, I can tell you with all the pride in my heart that when we launched our campaign, a family was separated across the street for where I live. And in a day, we fundraised more for that family than for the entire campaign in the first 3 months for race. And we were able to actually beat DHS and unify that family because of all the abuse that they did. So there's a lot of abuse that ICE is doing across the city, where they're violating people's rights, which is not even about people that didn't come following a process. In many cases, due process has been denied to people. They've been the visas that they came here, the asylum that they were protected, the TPS status that they had is been taken away. And when they go to 26 Federal Plaza, then they encounter this violence and they're kidnapped away. And in many cases, taking rights that they will otherwise have had to have access to citizenship and residence here. So we'll provide more information about that. And then the last piece of information is the Subway Avenue extension. So many of you probably have heard about the extension of the Q train. That is happening in East Harlem, and it's hailed as a project that is going to increase transportation equity for East Harlem, about $7.7 billion. Lots of people are very proud about that happening, and don't get me wrong, I'm excited that it is happening too. Now, the challenge is that when and how you develop the infrastructure projects matter. So we're getting a lot of reports from businesses where they are getting flooded because of the construction work, they're losing money, there's no plan whatsoever to address the needs of the businesses that are being impacted by the construction. And when we talk to the MTA to ask them, okay, so what are you doing to support small businesses? What is your plan to prevent displacement? They said to us that displacement was inevitable. So we don't believe that. We actually believe that our government agencies should plan better and actually work across the board to actually be able to prevent people from being displaced. And so we put it all out there. We created a project where we documented all the challenges of small businesses with policy recommendations, and we simply asked the MTA to do better, to make sure that they could support the businesses with marketing, that they actually consider the timelines on where they were doing construction work, the reality of the people living in the district. And this is a problem for infrastructure projects really across New York City and New York State. So if you see we encourage you to go to our website and take a look at the Do Better MTA project, where we're talking about the challenges that small businesses are having. And lastly, if you want to support our campaign, you can go to volunteer.oscarforcongress.com. We have canvassing events happening across the district every day. And so you can see them, you can join us, and we definitely will love your help talking to more New Yorkers about the work that we're doing. Thank you.
Eli is going to say hello, so please give a warm welcome for Eli Northrup.
I've been told I have 1 minute. So I mainly want to say thank you to all the club members who have come out for the campaign already. We've got people tabling outside of our office almost every day. Danielle, thank you. Lorraine, Billy, Marianne, Chuck, Daniel, Michael, there's been other people as well who I'm neglecting to mention. If you want to get involved, we have a building captains training this Saturday at our office at 11 a.m. We're going to be talking to people about how to write dear neighbor letters to people in their buildings. Also, if you want to knock doors with me, I would love to do that with you. So if you're interested in doing that, that's on Saturday. Fridays, we're at the farmer's market. Actually, 8 a.m., we're at the subway station at 96th Street, and then afterwards we go over to the farmer's market. I think Danielle may have said a couple words about a PAC that is supporting my opponent and planning to spend hundreds of thousands of dollars in this race. I'm not going to spend that much money, but the way you combat that is you have people show up. It's much more impactful to have people show up and talk to your neighbors, and I think we can win if we do that. So I need you, and I am so grateful for the support.
So now you know for sure that everything I told you about Eli at the beginning of the meeting is absolutely true because he's verified all of it. So give it up again for Eli, please. With that, ladies and gentlemen, we are adjourned. So grateful for your showing up tonight. Thank you very much. Give yourselves a round of applause.